Day 2 of our 30 days August challenge. Here is the question for us today. A client in the postnatal clinic is assessed to have a blood pressure of 180 over 96 millimeter mercury. The nurse should give priority to dash. A. Providing a calm environment. B. Obtaining diet history. C. Administering an analgesic. D. Assessing fetal heart rate tones. I'll leave you for 5 seconds so you can write the answer for me in the comment section. Okay, finally we have an answer. The correct answer is A. Providing a calm environment. Why must you provide a calm environment for this patient? This is because she is having a condition known as preeclampsia. Preeclampsia is a type of pregnancy-induced hypertension, and in this case, the patient will be having a very high blood pressure, and there will be traces of protein in the urine. So you will see other symptoms like proteinuria. So why do we provide a calm environment for this patient? A calm environment has the likelihood to prevent seizure. Now, when this patient that has preeclampsia goes into seizure, we can now say that the patient has finally gone into eclampsia. So at this stage where the patient has not had any seizure at all, we are trying to prevent this patient from having eclampsia, because this seizure could be dangerous to the mother and the baby growing in utero. So you don't want this for this patient at all. You have to do everything possible to stop this patient from going into eclampsia. Other options like administering an analgesic. Does she really need an analgesic? There's no history of pain. And then assessing fetal heart tones. That is a secondary assessment. So the first thing to do is to prevent this woman from going into seizure, because if she goes into seizure, that is when the fetal heart tone is going to be affected. So prevent this woman from going into seizure first. Although you may need to obtain her diet history, but that can be done later. But at this point in time, what we want to do is to make sure that this woman does not go into any kind of seizure, so that there won't be any problem for her or her baby.